And welcome back. Our first conversation this morning is with representatives from the Pan American Health Organization and the European Union. We have been joined in studio by Ambassador Eria Ascola. Good morning.
Good morning.
And she's accompanied by Dr. Karen Lewis Bell. She is a representative of PAHO and the World Health Organization. Women, ladies, good morning.
Good morning.
Thanks for having us.
Thank you.
Let's talk about the work that the EU and PAHO is doing in collaboration with the government of Belize. Where building out a strong and robust health system is concerned. What is your respective roles insofar as working with the Ministry of Health and Wellness on that end?
If I start, the European Union is very happy to support this sector in Belize because how we work with the government and with the implementing partners is that we set up our priorities together with the government, and health has been central to human development, but also social and economic development in Belize. So to implement the program, we work with the PAHO because they have the expertise, they have the know-how, and they have the capacity to know what kind of actions are needed on the ground. And then we work together with the ministry to channel the funds in the best possible purposes to maximize the impact. So here in Belize, we have worked on infrastructures, on buildings, on facilities, healthcare facilities, but also on equipment, capacity building. When there was the COVID-19 pandemic, we worked on the response for that pandemic. So our support is to the range of 26 million Belizean dollars, and it has been implemented over a certain number of years, and this program is now concluding. So we are happy to see that it's been impactful, and the impacts will be also felt in the years to come, because we have we have renovated some health centers, we have set up health centers that will be servicing Belizean people in the years to come as well.
You can speak about
Yes, thank you. So PAHO, as the oldest technical cooperation agency in health, has had a very strong and well-known track record of providing technical cooperation to our member states. And so I think it is without a doubt that PAHO was considered the best agency to partner with the European Union and the Ministry of Health to implement this project. And as Ambassador Ascola said, this project focused on 3 strategic objectives. We focused on trying to improve the climate resiliency of our health facilities. And so through that project, we retrofitted and improved the green facilities of 5 hospitals and a central medical laboratory. The second strategic objective focused on strengthening the health system and ensuring an integrated health service delivery network. And through that, we were able to support the Ministry of Health with developing various policies, strategic plans. The most recent one and the most important one, I believe, is the new 10-year National Health Strategic Plan for 2025 to 2034, which focuses on ensuring people-centered healthcare with equity towards achieving universal health. And we also ensured that we strengthened the integrated health service delivery network by building the capacity to deliver a comprehensive service for the non-communicable diseases, including mental health, and also palliative care, cancer care, etc., through the primary healthcare facilities. And we also, with the third strategic component, we looked at, well, we completed the development and delivery of what we call the Clinical Data Exchange Platform. So this is an interoperable database that the Ministry of Health's Belize Health Information System and the National Health Insurance RAWA system can speak to each other, so that the government and the Minister of Health, who is responsible for the health of the entire nation, can actually access real-time health data to do analysis, monitor trends, and use the evidence to inform policies and programs.
Let's go back a bit for a second here. You mentioned retrofitting 5 facilities, including the central medical
Plus
lab,
the central medical.
the central medical lab for climate resilience. And climate resilience is such a buzzword for the past several months, if not a few years now, where we're looking at buildings, we're looking at people, and how we're adjusting to the effects of climate change. How important was this from a health perspective to be able to accomplish these particular goals?
Well, generally speaking, PAHO is focusing on ensuring that the health sector remains resilient during times of disasters. And certainly Belize, because of its position, is very prone to natural disasters, in particular hurricanes. And so we wanted to make sure that the health facilities can remain operable during such times. And so apart from the building infrastructure itself, one of the things that we focused on was the installation of solar photovoltaic systems for all of these facilities, so that they can actually be able to continue to operate. We may not have been able to ensure that the entire hospitals or the central lab can be on the system, but we identified, in collaboration with the facilities and the Ministry of Health, the priority areas: accident and emergency, the operating theater, the maternity wards. Those are some key areas that need to be fully operational during times of disasters, when there may be power outages. And we looked at other greening activities, low flow toilets, low flow faucets, LED lights, inverter type air conditioning systems, because these actually contribute to reducing the carbon footprints of the health facilities. And generally, health facilities do contribute significantly to the carbon emissions that contribute to, you know, some of the changes we're seeing with climate change. And so in doing that, we have been able to reduce the carbon footprint of these hospitals. And the initial feedback is that it has been very positive. These facilities can actually see, and will actually see, a reduction in their energy consumption. So I think that's quite important.
I think of the heavy load and the weight of the work that both of your organizations or institutions are doing to contribute to healthcare development here in Belize. And I think of that in particular with one of the recent stories that we highlighted that documented the untimely passing of a baby on a water taxi because he was not able to access healthcare in time, coming from a polyclinic in San Pedro. Talk about the importance of having these institutions across the country, and perhaps really how challenging it is to ensure that everywhere gets the type of institution they need when we see our population growing, and a place like San Pedro, where they could have once functioned with a polyclinic, now has to have an actual hospital.
One of the things that the Pan American Health Organization is working with the Ministry of Health in doing is to strengthen the health network. So it should be a seamless system from the primary care level all the way up to the tertiary level with a referral mechanism. And so we are also building the capacity at the primary healthcare level to improve the integrated care, the holistic care of individuals, you know, for the diagnosis, the management of these conditions. And so we continue to work with the Ministry of Health. The principle of primary health care is that health facilities should be close to where people live and work, and that structures should be in place to be able to manage or identify who needs to be referred. It doesn't necessarily mean that everywhere has to have the highest level of care, because that's not efficient, that's not cost effective. But it's important to be able to identify early when a referral needs to be made, and that referral needs to be done in a timely manner.
When we think of the population and how we are growing as a country, do we feel, or do you ladies feel, that we have all the resources that is necessary to meet the medical needs in this country when we think of tertiary level institutions or tertiary level hospitals available?
I do believe that not all countries need to have everything in place. We have to think of what is most cost effective. I know when we, as individuals, we listen to the media, we want the best of the best. But we have to look at what the country can afford, what is most cost effective for the country. Sometimes it is better to purchase care either from the private sector or from another country, because the country may not have sufficient cases to sustain that type of service. But more importantly, a country needs to strengthen its primary health care and its secondary health care. And not every area needs to have a state-of-the-art hospital. As I said, there must be mechanisms to ensure that all facilities are part of an integrated network, and that mechanisms are in place for the timely referral of patients who need more advanced care.
So the European Union is an important stakeholder in all of what's taking place here. Is there any other initiative that ties into this that the EU is funding or partnering with?
Mm-hmm. Yes, indeed. We have an overall partnership which is much more comprehensive than only social development or health. And I would say that one area that we are focusing on is digitalization. And that certainly contributes to the not only to the resilience of health system in general, but it's also essential for data gathering, for data management, information, for research purposes, and also then for getting enough of reliable information on which to base future policies. So that's a very important part of our cooperation here. One of our top priorities, the digital innovation and digital solutions. So I would say that is very important. For the rest, renewable energy, that was already mentioned, electrification of the southern part of the country, where the electricity is not accessible to everyone. Mm-hmm. And this is one of our top priorities as well, to make sure that people get access to energy and renewable sources of energy, that also at the same time contributes towards your climate objectives.
Yeah. Any focus on rural communities?
Rural development, that's especially in the southern parts of the country. Social development is part of rural development, and renewable energy, access to energy is a big part of that, but also at the same time digitalization, to have access to internet, to have access to online education systems. All that is very important in that context.
How does this collaboration with the Ministry of Health and Wellness tie into building this country in a way that benefits, I think, the work that everyone is doing? When I think of viewers tuning in, they recognize that each body has their own role and responsibility. Of course, the government, they have to meet the needs of the people. But how does this tie in with the work that you guys are doing as well?
We, in our cooperation, we always align with our partner governments, and like here in Belize, it's the government that has established its health plan and strategic planning in the health sector, and the development plan. So we want to see where our objectives and our goals and our strategic priorities, where they meet, and then we develop our cooperation around those kind of objectives.
For us at the Pan American Health Organization, we are a member states organization, and Belize became a member in 1986. And so the member states are the ones that tell us what they want us to do. And so with Belize, with the government of Belize, we have a 5-year country cooperation strategy where we have agreed what technical areas we will partner with the ministry on to provide the support, because our primary role and responsibility is to provide technical cooperation to the government of Belize and the Minister of Health to implement their own strategic agenda for health. And coincidentally, next week, the Minister of Health and a small delegation from the ministry will be attending our 62nd Directing Council of the Pan American Health Organization, where the ministers, the senior technical officers of ministries of health in all our 35 member states will meet to discuss the health agenda of the region and to tell us as a secretariat what they think we should be working on to provide support for them.
So there's a 10-year strategic plan, as you've mentioned, that goes from 2025 to 2034. What are some of the key areas or some of the targets that you would want to, or the government should be meeting during this particular period?
So the focus is on people-centered care. The focus is also on universal health, ensuring that everyone has equitable access to health care, urban, rural, irrespective of where they live, and to try and reduce out-of-pocket expenditure for health. Part of this, though, is to ensure that there's adequate human resources for health. And in addition to that, the digitalization or the strengthening or the continued strengthening of the digital transformation of the health sector. It includes telehealth services as well. So it's a combination of strengthening primary health care, strengthening access to secondary care, ensuring the integrated health service delivery, ensuring the strengthening of the health systems network, among other things.
Is there any tie-in or perhaps a correlation with this particular strategic plan and the Sustainable Development Goals?
Absolutely. So the country looked at the Sustainable Development Goals and the commitments that they made under those. The country also looked at Plan Belize. The country also looked at the past strategic plan. So an evaluation of the past strategic plan was done to see what were the areas that needed additional strengthening, what were the areas that had achievement, what were the areas that didn't have achievement. And the country also looked to the future. What is the future of health like in terms of the digital space, in terms of telehealth, in terms of health information systems. So the country, so it was a collaborative process with multiple stakeholders, including academia, to look and discuss what was the future of health in Belize and what strategies needed to be implemented to achieve the goals that they set for the next 10 years.
When we think of going digital, we think that it costs a lot of money. We think that it comes with its own, I think, challenges as well. Are we prepared for any possible setbacks that could come with this type of innovation as well?
I am not sure about the setbacks, but I think it's a work in progress. And I think there are several things that need to be in place. So the e-governance structure, the regulatory systems, to be able to share patient data, to ensure confidentiality, to be able to actually tie it into other systems. Because certainly for the clinical data exchange platform, it would be quite useful. And there are other entities like the Social Security Board, the civil registration, that could actually link to that system. Because, you know, for many countries, they're moving towards having a unique identifier number for individuals. And so you can link records, whether in the public or the private sector, registration, etc. So I think this is the way that we have to go. I don't think we can avoid it. But at the same time, we have to ensure that systems and mechanisms are in place, the governance structure, the legislation, the regulations are in place, so that persons can be confident that their data will be safe, will be protected.
Are we feeling that we're on the path to meeting all of our goals that are set out? When we talk 5 years and some of the projections and hopes to go digital to give persons more access to healthcare across the country, especially in southern parts, in rural communities, do we see it being something that we can actually meet?
I do believe so. no government, I believe, would set these goals without thinking them through. The targets may not always be met because things happen. You know, with our project, COVID-19 came and it derailed us. And then post-COVID, there were challenges with the infrastructure, with the building sector. So I think, you know, the strategies have been well thought out. The activities that need to be implemented have been well thought out. And we can only hope that there's nothing to derail the process. You know, any major natural disaster, any major pandemic, any financial challenges, you know, global challenges. So I think we are committed to working with the Ministry of Health in providing the technical cooperation and support towards achieving the goals that they have set. And that's what the most we can do. We can try and do our best.
What about political changes? Every so often there's a new government that takes office, and perhaps its objectives may not necessarily align with what has already been committed to in a 5 or a 10-year plan. How do you adjust accordingly?
My experience, having worked in public health for almost 30 years, is that health and education are usually the two social sectors that don't see major changes when there are changes in government. These are developmental issues, health and education of the population, and more importantly, it is usually a collaborative approach that's taken towards developing the strategic plans for the health sector, the education sector. So my experience has been that there are no major shifts, and that the strategic plans continue more or less seamlessly. If there are any shifts, it may just be maybe the placement of health facilities, but not typically any major changes in my experience.
All right. Well, ladies, we are winding down our conversation. I'll ask if you have any final thoughts you'd like to share.
Well, thank you very much for having us, and it's been this is my third time that I visit Belize. I will have 3 more years to go. So this is one of the projects that is something very concrete. It's tangible. I visited one of the health centers that had been renovated last time around when I came in May. So I'm very happy to see that progress is happening on the ground. And now we will be focusing on the southern part of the country, and we will be focusing on the border management as well, but also the rural development, as you mentioned. That's a very important part of it.
I would really like to thank the European Union and the Ministry of Health for having the confidence and trust in PAHO to be able to be the implementing partner for this project. I do believe the project has been successful, and it has contributed significantly to strengthen the health systems and the services in Belize.
Wonderful. Ladies, thank you so much for joining us.
Thank you.
And before we move on to our next break, we want to include you in our motivational moment this morning. This morning's motivational quote comes from Dale Carnegie, and it goes like this: develop success from failures. Discouragement and failure are 2 of the surest stepping stones to success.
Wow.
Beautiful.
Beautiful.
Excellent.
Alrighty, we take a quick break, but don't go anywhere. When we come back, the conversation switches into showcasing Belize's beauty on World Tourism Day.